Okay, now I feel like the patients that I saw during my clinical rotations had a range of severity when it came to dry eye symptoms. We can classify dry eye disease into two categories. There's aqueous deficient and evaporative dry eyes. The problem in aqueous deficiency typically stems from the lacrimal glands. There's insufficient production of tears, and this can be caused by primary hyposecretion of these glands or things like Sjogren's syndrome, which is an autoimmune infiltration of the salivary and lacrimal glands that leads to dry eye and dry mouth symptoms. Now, evaporative eye can also have a lot of causes, but the most common is those meibomian glands. We call it meibomian gland dysfunction, but really those oil-producing glands of the eyelids can become obstructed, leading to those dry eye symptoms. Now, they may be vague, these symptoms, but besides dry eyes, patients may complain of foreign body sensation, itching, burning, stinging, and ocular fatigue, tired eyes. And make sure you perform a careful history, as there are a handful of medications and conditions that can also cause secondary Sjogren's syndrome. Medications like anticholinergics, antihistamines, tricyclic antidepressants, alpha blockers, and some antihypertensives can contribute to these symptoms. It is also important to determine visual acuity and inspect the eye's surface for things like corneal abrasions, because these can result in dry eye symptoms as well. A Schirmer test can be performed to assess the production of tears, really. And it's a little strip of filter paper that gets placed beneath the lower eyelid, and it's removed after about 5 minutes. And if there's about 10 millimeters or more of wetting, this is without anesthesia, it's considered diagnostic of aqueous tear deficiency. If Sjogren's syndrome is suspected, typical labs may include SSA, SSB, rheumatoid factor, and ANA to kind of help rule out or determine autoimmune involvement. Now, treatment is first appropriate hygiene and discontinuation of possible offending medications. And there's also some evidence that supports dietary modifications, such as following a Mediterranean diet, fish oil use, omega-6 fatty acids, and vitamin D supplementation for the use of cardiovascular health that may also have a beneficial effect on these dry eye symptoms. Now, for pharmacological management, artificial tears are first line. There is also high viscosity gels and ointments that may provide a better moisturization and barrier and protection, really, of that ocular surface. And further treatment options require a referral to ophthalmology and may include things like a topical cyclosporine, or even scleral contact lenses to help keep the eye surface from drying out.